answers the question correctly, you should be able to answer the question correctly. If nobody answered correctly, that's fine. All right, so 80% of it, there are 100 questions on this test. There are 100 questions on this test. 80%, in my opinion, about 80 of them are pictures of muscles. Just identifying muscles. Yeah. Ms. Stanley, do you know that you're muted? Or you're kind of talking at the screen like a cat? And they're like...
I was not saying very nice words. It was a good thing.
Good. You stay muted. All right. Let me show you the screen. Too cute. These should be familiar. You've seen a lot of these, but there are new ones coming at you this time. Okay. Muscular Anatomy Boot Camp. So the idea is when we have meetings, which we actually just had one a month ago, with top employers in the Valley. And so our last meeting that we had 20 employers in it, representing, honestly, like 60 locations here in the Valley. We asked them, like, what are students missing when they come out of school? What do you notice when and they're not talking about our school, they're talking about schools in general. And they keep telling us the same thing. We just had a redo meeting, so to speak, a month ago to make sure they're still saying the same thing. But employers are saying 3 things are their biggest issue with massage therapists in the state of Arizona, and that's attendance, attitude, and anatomy. They have a hard time getting them to show up to work on time. That's the #1 reason they fire therapists, by the way, is because they're late. They have problems with attitude, and people don't get it that just because your massage is good, your attitude has to be good too. And they don't seem to know their muscular anatomy. So this test, we have focused this entire course, if you think about it, on showing up on time, having a good attitude, and muscular anatomy. And so we're going to close that deal with this muscular anatomy test coming up to make sure that you walk into places and you know your general anatomy really well. Yes, Ms. Monreal.
LOL, you said Monreal, but it's Hunter.
Well, no, it was Ms. Monreal too. She had her hand up.
Sorry, I was talking, but my mic was off, so sorry, my bad. Is that meeting a meeting that just you guys have with these people, or do other schools do that also and have this meeting to get the feedback?
Other schools, I know Phoenix College does.
Okay.
I don't know if other massage places do.
Okay, interesting.
Yeah, we call them, what do we call them? Workforce development meetings. And we really are looking to make sure that we're providing, because like, what if I taught you guys about focused on the systems of the body, and they said, well, that's great, they really understand the heart now, but that's not used in their field. And that's honestly why we talked to them. Like, what are your biggest complaints? What are the problems you see out there? And this is the stuff they identified to us. And by the way, they also identified that people aren't very good at deep tissue. But those were the 4 big things. And we said, for one thing, we agree with them. I agree with them. Those are the biggest problems I saw out there. And so we said, let's create a course that really deals with that stuff so that you're known to come from a school that produces massage therapists that don't have this problem.
Yeah, I think that's really cool that you guys do that.
Yeah, it is super cool. It also builds really strong relations with the employers too, so that you all get jobs and all that kind of good stuff. But yes, we do it specifically to make sure we're really training you to the best of our ability to what the market needs for you guys to make money. Miss Hunter.
I thought when we got out in the field that they weren't too stressed about anatomy.
Well, they're not. So you want me to prioritize what they're the most stressed about? Does that make sense?
Nah, sure.
I mean, it's kind of like saying it's like saying, what do you want in the perfect partner, right? You've got a list, and you've got some make or break items, and you got some other wish stuff that you could do without. Like, I wish they were 6'2", but if they're really nice, I don't care. They could be 5'7", whatever. Anyway, employers tell me the number one thing is showing up on time. It's the number one problem they have. And it's such a big problem because if you, Miss Hunter, just use you as an example, don't show up, they don't have another massage therapist sitting around to cover for you because they only get paid if they're working. So they don't want to sit around and cover for people who just don't show up. And then they run into a second problem. Even if they have somebody to work on your clients don't want anybody but you.
Right.
And so
You know,
it creates a big problem for employers. That's the number one thing they say.
yeah, and what's so funny about that is I already know that that's my like weak spot is showing up on time.
Yeah.
So that's why I really want my own business.
Yeah.
Because I plan on having like my own little like spa place where I tell people to be there. I'm already there, right? But I tell them to be there between 1 and 2 or something. So I have time. And they could just be chilling in the lounge or something. I don't know.
Oh yeah, you can totally do that. I want to warn you about one thing, which is once clients realize that you're not on a strict time schedule, they won't be either, though, just so you know.
Yeah, I know. Well, I was thinking like if I offer something like, I don't know, like I said, a lounger with some headphones or something, then like they would be there at 2, but they know that their appointment's not until 2:45 or something like that.
No, you could do that. Absolutely. Yeah.
I don't know. It's just something in my head because I was like, what am I going to do about that? It sucks. Anyway.
It does. I just noticed this too. Like, I was once late with a client, a personal client, and they're like, oh, it's no big deal. But then I noticed after that, it was no big deal. They were very nice about it. But after that, they started to be late. And what can I say to them? I was like, oh, I guess it's no big deal either if you're late.
Well, I don't want them to be late, but I don't want me to be late. So anyway, I have to figure it out.
You'll figure it out. But yes, I commend you for something though, Miss Hunter. I commend you for recognizing who you are, not judging that, but figuring out a way to work with it. Does that make sense?
Right.
Like, I know that I'm this way, so how am I going to operate a business then? Good thinking.
Thanks.
Yeah. Okay. So employers, by the way, said that attendance was their number one issue. Guess what? Their number 2 was actually attitude. And I had an employer from a very large chain who's run some very successful places lean over to me in a meeting and say, actually, to be really honest, I don't even care if they're that good at massage. I just want them to be nice. He's like, we have bigger problems with that, and that drives away clients. People understand when your massage is a little shaky. They don't understand when you're not nice. And so that's their number 2 thing. Yeah. Massage skills are 3, and anatomy is actually 4, to answer your question. Muscular anatomy is the 4th thing. It is not in the top 3 priorities. So, if that helps. Top 3 priorities would be attendance, attitude, massage skills, then anatomy. Yeah. Maybe attitude. Yes. Well, it's part of the reason, Miss Stanley, you're very cute, but it's part of the reason we do daily gratitude and things like that, to kind of teach you how you can at least temporarily change your attitude, right?
There won't be no gratitude when we're on our own.
You might have to take the lessons you've learned and take them out into the world and create the gratitude.
And I can't like just ask my client, like, what are you grateful for today? They might think it's weird.
Oh, yes, you can. It's a great thing to do when you have a client come in and they're like, oh my God, I'm so stressed. All this stuff's going on. Oh my gosh, I completely understand. I'm so stressed. You're in the right place. I mean, acknowledge what they're saying. Don't shut them down. But then, hey, I realize you got all this stuff going on, but can you tell me one thing you're grateful for? And they will stop dead in their tracks and they'll go, well, I'm grateful I'm getting a massage. I'm grateful you're getting a massage too. I love it when you come in. Yeah, I love my massages. It changes the whole thing. Yeah, you really can't ask them. But also what we were trying to teach you is you don't really think that I wake up every morning with a smile on my face, do you?
Yeah, kind of.
Okay,
I mean,
good.
your girlfriend brings you coffee in bed. Why? Like, what?
That does help
Of course you
a
wake up
lot.
with a smile
That does
on
help.
your face.
And maybe I kind of do, but part of it is modeling that this is my job, right? So my work pays me to bring my best self here. Like, you know, at home you get to be your real self, but a lot of people are like, oh, I got to be authentic and all this stuff. There's nothing authentic about going to work. None of us want to go to work. You're already being inauthentic. So, but they're paying you to bring your best self. And so you just kind of learn to do that thing of like, I will be grateful for this job and for the 3 hours that I'm here. I'll do this thing. Yeah. And you are getting very good at that. You've come a long way.
I don't know.
I've seen more and more smiles out of you. I've seen you laugh at stressful things. I've seen you blow off in a good way things that could be annoying. I've seen some really, really good work with your emotions.
Well, at least there's a hope.
There is hope. Yeah. Yeah. There's hope and there's been improvement already. So I feel very positive about where you're at. But yes, it might take continued work. But if you ever want to call me, say I'm heading into work, I'll ask you what you're grateful for. I'm serious.
I
Every
might
day.
seriously call you.
I'm totally fine with that. Yeah.
Okay.
You'll see me again after you graduate, trust me.
I hope so.
Pretty sure about that too. Okay, everybody. Muscular anatomy boot camp, right? Kind of got to make sure we got the fourth leg of this four-legged chair nailed down here. Remember, there are 640 muscles in the body that is on the test. But the point is, you can't remember all the muscles. This is one page of muscles. This is another page of muscles. That's a lot. And there's no way you're going to memorize all those. But you'd be surprised that basically many of you have the ability to figure out where most of these muscles are now because of rules we've learned. And remember, this is a chart that actually shows which muscles, which words are used the most. And things like flexor, levator, longus, brevis, rectus are familiar words that we use in a lot of muscles. And so we're going to use those today because when we get to the forearm muscles, everybody, just to let you know, when we get to the forearm muscles, we're not expecting you to memorize those. We're expecting you to use really smart stuff. Like, is it running along the ulna? Is it running along the radius? Is it on the anterior side and it's a flexor? Is it on the posterior side and it's an extensor, so that you can name these muscles? So let's play with this a little bit. Get ready, everybody. I'm not going to go into how muscles are named. We've talked about this before. They're named on size, shape, orientation, all sorts of stuff. So let's go on. We'll come back to that later. Okay. Wow. All right. So, we have a foot here. We have a foot here. And I'm just going to go in alphabetical order here, of course, in reverse. Miss Giannis. She's like, I hate. Miss Giannis, I think, by the way, and I don't know, so we could both get this wrong, but I think he is pointing to, there's three muscles being shown there. One's going to the big toe, one's going to a lot of the digits. I think he's pointing to the one that goes to the little toe. And everybody, I want you to know right now, I mostly sincerely don't know exactly what this muscle is going to the little toe. But Miss Giannis and I are going to talk through what are the possibilities, right? And this test that you're taking is set up not to get nitpicky with you. It's set up to just be like, can you make some really solid inferences about this? So it's going to the little toe. So what do we suspect is in the name?
Digiti.
Yeah, digi-minimi. It's possible because it's on the foot that the word brevis is in it. We don't know that, but that would not be a crazy idea. So digi-minimi may be brevis. Any other ideas about this muscle, Ms. Giannis? Because I've got two other ideas about it. What action do you think it might perform?
It could flex the pinky, or I guess abduct because it's kind of going off to the side.
Beautiful. So, Ms. Giannis, you've now just reported everything I know about this muscle. She really has. I'm going to guess it's an abductor because it really, really is off to the side. I know the muscle, but see how it like wraps around to grab the pinky off to the side? So it would not be crazy to call this abductor digiti-minimi. I don't think you have an abductor digiti-minimi longus, so I'm going to leave out the brevis. But let's see if that logic kind of worked for us. Yeah. And honestly, I didn't know that. I know I've been teaching a lot, but we were in the right ballpark. And I promise you the test would not have flexor digiti-minimi on it. Like, it's not trying to really trip you up, but it does want to know, like, can you kind of figure some stuff out, right? So that's kind of cool because you don't have to memorize all this stuff. Good job, Ms. Giannis, by the way. I love the way your mind worked. You picked up all the important stuff, and she at least narrowed it down to two things to guess on right away. Yes, Ms. Petrie.
So if it's not coming to the actual pinky toe and it's going more to the side, then you should be thinking adductor. Is
Ab,
that
abductor.
I'm sorry,
Because
abductor.
we see it kind of sneaking around the side there, and that means if it grabs, it's going to pull the pinky toe out.
Okay.
That's where we
Okay.
came up with that. If it was going more straight, like look at the other muscle there that's going straight to the pinky toe. It's going straight to the other toes.
Right.
That's a flexor something. Yeah. That's going to come up in the next slide, I'm sure. But yeah, that's why we said abductor, because it's on the side, so it would probably pull out. Ms. Torres.
Yes.
Ms. Torres, can you tell me what both these muscles are?
So it's a flexor digitorum brevis. No.
Yeah, I think so.
Yeah. And then the other one is Hollis's.
I'm going to guess that
Is
I think it's actually
wait. It's in the side. It's not an adductor, is it?
No, it's not an adductor. It's to the side. It's either on the bottom or to the side. So it's one of two things.
So it's a flexor Hollis's brevis.
Yeah, although I think it's going to be abductor hallucis. I think it's more to the side.
That's what I said, and you said no.
Oh no, I'm sorry. I said it could be one of those two things. I apologize.
Oh.
I thought you said adductor, and I was like, no, it's not an adductor. It's an abductor.
Okay.
That's why I said no. So I love what she said. She said flexor digitorum brevis, which makes a lot of sense because we know there's a flexor digitorum longus up in the leg.
Yeah.
So she's got to be right about that. And then this abductor hallucis, or flexor hallucis, but I think it's abductor hallucis. But she got the hallucis, which is really important too. Yeah, good job. Really good job. Really good job. So by the way, you might literally see these pictures and it'll say, what's the muscle in red? And you'll have 4 choices. And that'll be 80% of your test. And I think we're going to go over this slideshow twice, so you'll be pretty familiar with these. Plus, I am taping this slideshow, so you could go into today's lecture and rewatch it again on YouTube if you wanted to. Yeah? Yeah, cool. Thank you, Ms. Torres. That was good. Miss Stanley. What is this muscle?
So this time it's on top, so it's an extensor digitorum brevis.
The only way you could be wrong is if there's not a longus, but I think there's a longus. So you said it's on top, extensor. It's going to multiple digits, digitorum, and it's short, so brevis is a good guess, right? But it's definitely extensor digitorum. Great thinking, great thinking, and you're right. And you should be proud of yourself. That was really good. So you guys are now starting to be able to identify muscles without even having them fully memorized. Yes, Ms. Hanson.
The tests won't have, I mean, they're not, if it doesn't have the word brevis in it, they won't have it in there, right? They won't have a brevis and a regular thing, right?
I don't think, Ms. Hanson, it's been a long time since I wrote the test, but I wrote it to really figure out if you knew certain things, and I don't think like on this one, I did not have an extensor digitorum brevis and extensor digitorum longus, right? It would be two, I think that's what you're asking.
I'm asking more about like extensor digitorum, you're not gonna have, if it's a brevis or just extensor digitorum, you won't have the words brevis or longus in them, right?
Well,
If it's just an extensor without brevis or longus, you won't have another word in there.
Oh yeah, I'm not trying to measure whether you know every longus and brevis in the body. Does that make sense? So yes, if this was just extensor digitorum, that would be the only choice. There would not be a longus and a brevis to throw you off track. But I'll tell you what there would be in here. I guarantee you, if I wrote this thing, one of your choices would be flexor digitorum brevis, because I want to know if you know which ones are on top and bottom. I bet you I'll put in there extensor hallucis brevis to make sure you realize this thing's not going to the big toe. I might have extensor digiti minimi brevis, where I'm really trying to see if you understand the concepts. But no, nothing on the tricky side, no. Yes, Ms. Hanson. Oh, okay, cool. Those are really good questions. Miss Petrie, you ready? Let's see what we got for you here. What is this muscle, Miss Petrie?
Let's see. That looks like Flexor digitorum brevis.
Yeah, I mean, brevis is always a good guess when you have short muscles on the foot or the hand. Sometimes it's not true, but flexor digitorum is definitely true, right? And there actually is a flexor digitorum longus that we know lays underneath the calves. So brevis is definitely in there. Good. I'm waiting for you to smile because you did a really good job.
Oh,
No, not because of me. I want you guys to be like, I think you don't realize how much you know now. And it's quite impressive what you can do. Really good job. Cool. This is why I'm not too worried about the test as long as we prepare. Okay. Just out of curiosity, Miss Nguyen, I don't think this will be on the test, Miss Nguyen, but it's just good to know. Do you have a guess what this is, Miss Nguyen?
Yes. That I think is the tendon.
It is. It's the plant. She said a tendon, but that's actually pretty close. It's the plantar fascia.
Yeah,
It's just a picture.
fantastic.
And I don't think it's on the test, by the way, everybody. I just thought it was kind of a cool picture. You've got all this other fascia in your foot that gives it springiness, not just the muscles.
Yeah.
Plantar aponeuroses, they call it here, but plantar fascia and plantar aponeuroses are the same thing. Okay, Miss Nguyen, what is this muscle?
I think what about that in the I think in the extension digitorum.
Keep going.
Extension digitorum longer.
Yeah. I would just we know there's a brevis now because we just did it, but I would guess longus just because the thing's long and it's up the leg. But extensor, it's on top. It goes to the digits, digitorum longus. I think Miss Nguyen, you got it perfect. We're not surprised. Thank you, Miss Moore. Miss Moore.
Yes.
Miss Moore, what are you looking at a picture of right now? I mean, it's a foot, but what muscle is in red here?
Flexor hallucis. No.
If it's on top.
Extensor hallucis brevis.
Yeah, I mean, it's extensor hallucis something, huh? I think brevis is a really good guess because I don't remember another hallucis on the top of the foot there. Oh, I lied. Extensor hallucis longus.
Oh.
But by the way, on the test, it would not have had hallucis longus and brevis. It would just have one. So extensor hallucis is great. Good job. Really good job. Really, really good job. Thank you, Miss Moore. Okay. Miss Monreal.
Yes.
What is this muscle, madam?
Tibialis anterior.
Yes, and you are 100% correct. What tipped you off that it was tibialis anterior?
I can see the title on top. I'm just kidding. No, I can't.
I was like, really?
No, but I knew you would look. Because it was by the tibialis.
So that's good, by the way, ma'am. But
Okay.
let me give everybody one other thing to remember.
Well, hold on. Can I add the other part?
Yeah.
So the peroneals are further out.
Yeah.
And then more medially, would that not be like gastrocnemius or something? Like poking out?
Yeah.
Okay, so anyways, that's just what I was thinking.
So one other thought, I mean, your thinking's excellent. One other thought is the tibialis anterior is one of the few muscles, in your leg here that goes from lateral to medial.
Oh,
It
that's true.
starts
Thank
on the
you.
lateral side of your leg and goes medial, which means if it contracts, what two actions can it produce, Miss Monreal?
Okay, I always I get confused with these, but give me a second. So a dorsiflexion?
Yes, everybody, and that could be a test question. I could see that. Yes, because we can see that it would pull up your foot to stop a door. Dorsiflexion, that's one of the main things it does. Is there anything else you could see it doing since it grabs on the inside of the foot?
I get confused with these too, but is it inversion?
Yes. The soles of the feet, it would pull them over so they would look at each other and they would invert. Really, really good. That's the kind of thinking we want. Thank you, Miss Monreal. It's been a pleasure. It's good stuff. Okay, Mr. Kandaris. Tell me what muscle this is, please, sir.
Gastrocnemius.
Yes, sir. How many joints does it cross over?
2.
Yes, sir. And therefore, what are the two main actions it can create?
Plantar flexion.
Yes.
And
Doing
I
great.
don't remember the other one.
And the other one. Yes, sir. So sometimes we have to say what the other one is, though.
No, I don't remember what the other one
Oh,
is.
well, what do you call it when you bend your knee?
Oh, flexion.
Yes, good. Flexion of the knee. Awesome. Thank you, sir. Yes, Miss Monreal, please.
Was I incorrect in saying from the anterior view that you can see the gastrocnemius?
No, you were not incorrect, ma'am.
Okay.
So,
Because that throws me off sometimes, but
sorry.
I wanted to know if that was wrong to
yeah,
think of it
no,
that.
and you can definitely
way.
see the soleus. Like this stuff, the stuff that gives your leg width is really soleus, maybe some gastric and stuff. So you can definitely see at least the soleus, maybe the gastric from the front. You're right, they peek out from the sides of the leg, if that's what you mean.
Okay, yeah.
Yep, so you weren't crazy. At least not about that.
This time.
This time, yes. Miss Hunter. Miss Hunter?
Yep.
Hey, Miss Hunter, what muscle is this, madam?
It looks like the soleus.
I think. Let's see if you're right. I'm feeling pretty good about it. Soleus, good. This is the calf muscle. How many joints does it cross over?
1.
Yes, you're right. And what's nice is once you can visualize a muscle, you can kind of figure out how many joints it crosses over. So it crosses over one joint. It probably only does one action. That's not always true. But what is the one action this muscle does?
It dorsy? Is it dorsy? No, it's plantar flex. Nope, it's dorsy. Nope, it's plantar.
Is it Dantar or Plorsi? Which one is it?
Okay, so it's in the back and it pulls up, so it must be plantar.
You're right, man.
Okay,
Good job.
great.
Really good job. I love how you work through that in your mind. That was beautiful. It does plantar flexion. It pushes you down. You plant so hard you raise up on your toes. Beautiful. Nicely done. And Miss Monreal,
Yes.
can you see this is a picture actually of the soleus and gastrocnemius poking out from behind the
Yes.
the
Okay.
thing. So that kind of answers your question there,
Okay. Thank you.
especially on the medial side. Okay. Miss Harper, what is this adorable little muscle up here?
Sure. That's the back plantaris.
Yeah, it is the plantaris. How many joints does it cross over?
2.
Yeah, so what are the two actions it can create?
Flex the knee and plantar flexion.
Yeah, beautiful. Yeah, beautiful. Thank you, ma'am. That was
Thank you,
really
sir.
nice. Now, the only thing, by the way, it's hard on the year-end test is I'm assuming all, these are kind of going in order of muscle groups a little bit, right? Your test will not. It will not be so sweet to you about that. But plantaris, longest tendon in the body, plantaris. The muscle's about the size, the muscle belly's about the size of my thumb, but the tendon's, you know, long. Very cool. Okay. Miss Hanson, what do you suspect these are? And I say these because I think they're talking about two muscles.
I would say they're the peroneals.
Yes. What's another name for the peroneals?
Fibular? I can't do that.
Fibularis.
Fibularis.
Cool. So peroneals or fibularis. So peroneus. What are the two names we give them since there's two peroneals? Coolest and
anterior and posterior.
What about longest and brevis?
Longest and brevis. Where's they both look long to me.
Well, the longest is can you see my cursor?
Yeah.
That's the longest comes up here. The brevis is underneath it down here. It only comes up to here.
Okay.
That's why it's hard to see. But that's your peroneals. Longest and brevis.
So one's on top of the other?
Yes. Yes,
okay.
Which is why when I'm rubbing them, people are like, which one are you on? I'm like, I don't care. I'm on both. But I will tell you, the brevis hooks onto this little bump on your foot right here, and the longest actually goes underneath and meets with the tibialis anterior. So we tend to focus on the longest more. But anyway, we rub them both together. Because those go, this is a very hard question, by the way, but because those go around the lateral malleolus of your ankle, which makes like a pulley, and because they hook to the outside of your foot, what are the two actions they can do? There's two different actions they can do.
Eversion.
Yes! They can turn your foot out. Yes! And the really hard one to see is the pulley action on this.
Can they dorsiflex?
Plantar flex.
Plantar flex?
Yeah.
Okay.
It helps with plantar flexion. They do the exact opposite of the tibialis anterior. That one's hard to see. Good job. We're good. Miss Felix Osuna.
Hi.
Hi, Miss Felix Osuna. What muscle is this we're looking at?
Is that the rectus femoris?
Yeah, I think that's a really good guess. Why did you not guess like the vastus intermedius, which is right underneath it?
Well, because the rectus femoris crosses over two joints.
Yes, so I hope everybody heard what she said. She's guessing because this thing goes so far up this guy's shorts that it's heading towards the anterior inferior iliac spine. Because it's longer, she thinks it's the rectus femoris. It looks like it's going to cross over two joints, and she's right. So, what are the two actions of that muscle, ma'am?
It flexes the knee, right? Or extends the knee. And then it has to do with the hip movement.
Yeah.
Tension of the hip. Or flex.
Flex. It bends in front. Almost everything that bends in front except for your knee does flexion. So flexion of the hip, extension of the knee. Or anterior tilt of the hip, extension of the knee. Cool? I hope. Yes? Maybe? Okay. Okay. Miss Cooper.
Hey.
Hey, Miss Cooper, what is this muscle? It's a very unique muscle.
Is that
Yes.
the gracilis?
Well, I know it's kind of between the legs, but it's a little more complicated than that. Can you think of a diagonal muscle that's very superficial on your thigh and inserts into the mismon real pes anserinus? I mean, the gracilis does, but it doesn't go diagonal.
Hold on. Sorry, I'm going to be the first person to mess up per usual.
It's okay. I do not want you to feel that way at all. Please don't. I've already messed up one of these. There was something I thought was the longest or brevis, and I should know this stuff like the back of my hand, so do not feel bad. But think of a muscle that's not in a muscle group that's found in the thighs. It's not a quad. It's not a hamstring.
Does it start with the P?
Doesn't start with a P. Not an adductor. It's the Taylor's muscle. That's the nickname for this muscle. And it starts with an S.
She start with F.
Yeah, it starts with S.
I'm trying.
Yeah, I don't know if she knew you heard. That's all. Don't feel bad.
Sartorius?
Yes! Sartorius is the diagonal muscle that allows you to do 3 actions basically at once so that you can sit cross-legged. This is the really hard part, Miss Cooper, and I'm sorry. But
Well, it's all hard to me, apparently. I'm not very smart.
Oh, I think you're doing just fine. I don't blame you, though, for, like, finding it, like, frustrating. I totally get that. I totally get that. But you're plenty smart enough. It's fine. And this is, you haven't seen these pictures very much. This is why we're doing this review. So don't worry about it. But the sartorius crosses over 2 joints, your hip and your knee. Do you know what actions it might create? Or what actions you'd have to create to sit cross-legged? To actually, if I had to sit cross-legged, I'd have to lift this leg up, turn it out, and bend this knee. So what do we call lifting this hip?
Extension?
So extension's back. This is in front. Almost all flexions happen in front. So flexion of the hip.
Mm-hmm.
What do you call when you bend your knee? It's the one thing that happens behind you.
Is that not extension?
No, this is actually flexion. It's the one flexion that happens behind you. So I know it's confusing, but you got flexion of the hip, flexion of the knee, and then what do you call when I rotate out like this? Rotate out like this. When my whole leg rotates out. What kind of rotation is that?
Radial rotation?
So medial's in the middle. If it's going out to the side, what would you call that?
Lateral.
Yeah! Good. So flexion of the hip, flexion of the knee, lateral rotation. That's the hardest muscle in the whole body when it comes to movements. So don't feel bad. Don't sweat it. I'm going to come back and ask you about it again. So don't worry. I don't know if that's good news or bad news, but you'll know it by the time we're done, I promise you. You're doing just fine. Okay. Miss Bilotic.
That's the vastus lateralis.
I love that you got that it's a vastus.
Mm-hmm.
Remember the lateralis is found on the lateral compartment of the femur.
Oh, wait, isn't that right?
Well, it makes up the whole side of the leg, though. And I don't feel like this person's on the whole side of the leg. I feel like they're on top of the leg still.
Yeah, they kind of are.
The vastus lateralis really is big. It's huge.
So the vastus intermedius, because it's underneath the rectus femoris.
Very proud of you. That's great. I love how you self-corrected. Yeah, it's vastus intermedius. It's shorter than the rectus femoris because it doesn't cross over 2 joints. What is its one action, ma'am?
To flex the leg.
Ah! You were so close. You were starting to say the right thing. Extend the what?
I almost said extension, but I caught myself.
I know, but extension's right.
It is?
Yeah, when you extend your knee out, yeah.
Oh, I'm thinking of, never mind, I was thinking of flexion. Oh my gosh.
No, you're okay. So extend the knee. That's why we're here. That's why we're doing review. So everybody, I know flexions and extensions are really complicated. They really are. They throw us all off. But all the bending in front of your body is a flexion except for the knee. The knee is the one thing that bends behind you, and that's a flexion. Everything else in front's a flexion.
Okay, so it's flexion of the knee.
No, extension of the knee.
Extension of the knee.
Because it kicks your leg out when it tightens
okay.
up. Extension of the knee. Cool. All right, thank you, ma'am. Thank you. Miss Yanez, what's this? Big, beautiful muscle. And if you need help, ask Miss Bilotic because she knows.
Is that the vastus lateralis?
Is it really big?
Yes.
Is it on the lateral side of the leg?
Yes.
I think it's be a good guess. I'm not trying to be a smart ass, by the way. I just meant like, yeah, good job. Good job. Vastus lateralis. What is its, it only goes across the knee, so what's its action?
It extends the knee.
Thank you. Thank you. Good. Moving right along. Thank you, ma'am. Ms. Torres. Ms.
Yes.
Torres, what is the muscle kind of on the meat, this teardrop muscle that he's pointing to? What is this
Vastus
teardrop?
medialis.
Vastus medialis. You're right. Good job. Good job. What's the action of vastus medialis?
Extend the knee.
Thank you, ma'am. Beautifully done. Miss Stanley. Miss Stanley, don't shake your head at me, young lady. Miss Stanley, what muscle group is this? And this person
That
is
the hamstrings.
that is the hamstrings. They're beautifully compartmentalized, and they're actually walled off between the adductors and the vastus lateralis there. So let's see. Hamstrings, you are correct. What are the two actions of the hamstrings?
Flex the knee.
Yes.
And extend the hip.
Yes, which earned them the nickname what?
It's not hip hikers. Hang on.
No, but you're on the. I mean, I get where you're coming from. You're on the right track. Thing. You know what I mean?
It wouldn't be joggers, was it? Would it?
Walkers. So that's pretty.
Walkers.
Yeah, that's pretty darn close. And by the way, I don't think that's a test question. I just thought it was important trivia.
I was just trying to think of like the actual like. I was just like,
Yeah.
I ran track. I should have known that one.
I think you did fine. You did know that one. You knew it was the hamstrings, and you knew there were two actions. Sorry. Bless me. All right. Good job, Miss Petrie. What is that?
Is that the Gluteus Maximus?
Well, it feeds into the gluteal tuberosity here, into the IT band. It covers the entire side of the sacrum here, a little bit of the posterior iliac crest there and such. And you are right. It is a large, big muscle back here would be a good guess, period. But yes. What is the main action? There's actually two actions, but can you give me the main action of the Gluteus Maximus? Or two main actions if you get really fancy?
I want to say that it flexes the hip.
So does
I
it?
don't know.
So it's behind you. It's going to pull your leg behind you. What do you call it when your leg goes behind you? Your hip.
An extension.
Cool. So it's an extensor of the hip.
Okay.
And because it's going diagonal, can you see how it might laterally rotate your hip?
Yeah.
Okay, that's all it is. Extensor of the hip, lateral hip rotator. Good job.
Okay.
You guys, it's okay that you're not 100% perfect on these. We're doing really good. All right. Miss Nguyen, what is this muscle?
Gluteal. Gluteal medial.
Yeah, I think it's gluteus medius too. It's on the side.
Yeah.
Gluteus minimus is a little bit.
Medius
I think it's medius too, but it's definitely a gluteal muscle, right? And it is the gluteus medius. Good job. What's one of the actions of the gluteus medius? It's got all sorts of funky actions, but since it's on the side, what's one of its obvious actions since it's on the side?
Ladder.
Ladder?
Oh, no, not ladder. I think it's the extension on the hip too.
It can. But since it's on the side of your body, you're right, by the way, Miss Nguyen. On the side of your body, what happens if it pulls your leg out to the side? What do we call that?
Abduct.
Yeah, abductor. You were right about the other thing you said. It's got stuff going in multiple directions, but abductor. Cool. Very good. Thank you, ma'am. Okay. Miss Moore.
She's in the restroom.
All right. Can you answer for her?
Yes.
What what muscle do you think this is, sir?
Hold on.
I'll come back to her. Don't worry. It's fine. That's fine. Okay.
He said he'll come back to you.
Yeah, no worries. Thank you for letting us know. Love
You're
that.
welcome.
Miss Monreal, what muscle is this? Well said, Miss Stanley. Miss Monreal?
Oh, I was saying, hang on, because I'm driving. I'm going to pull over real quick.
Okay.
So that's the inside of the leg, right?
No, it is the outside of the leg. This person is like in fetal position with their outside leg over a pillow. That's their hip, essentially.
So is that glute medius?
Well, so this was glute medius.
Okay, well, I didn't get that. Okay, so then what? I mean, I guess because of the position, I would want to, like, say TFL, but TFL isn't shaped like that and it's scooted over.
Yeah. And the gluteus medius is found, minimus is found a little bit underneath the medius.
So it is minimus?
Yeah.
I just thought minimus was over a little bit more.
No.
Okay.
That's why we're doing these pictures. It's hard. It depends on where the hip is, all sorts of stuff. But gluteus minimus. So because it's got some fibers in front of the hip here, what action would these fibers right here do that are in front of the hip?
Oh gosh. Okay, so, is it laterally rotate the hip? Or no?
Yeah, but I mean, okay.
Okay.
I have to think about that one. You might be right, but no. Not those front fibers. They might medially rotate the hip, but they're in front. What do you call it when the hip bends in front?
Flexion?
Yeah. So they are hip flexors. The gluteus minimus is a hip flexor, among other things. And what's another word for hip flexion too? Hip flexion could also be what kind of tilt?
Anterior?
Yeah. So this could be a muscle that's culprit of anterior tilt.
But how is that in the front? That doesn't look like it's in the front.
Well, that's why I said this is the greater trochanter here, kind of poking out. You can see it. These fibers here are in front of it. So they're in front of the hip. And that's why it can act as a hip flexor. It can do other things, but I'm highlighting at this point stuff you guys need to know as massage therapists, right? Like when you walk out the door. And I care about the gluteus minimus. It can do other things, but I care about it because it's a hip flexor and can create anterior tilt. That's one of my big reasons. Miss Torres, yes.
So which muscle is the one that is like rising? Is it the minimus?
This whole thing is, this whole muscle is gluteus minimus.
I know, no. I'm talking about it's like it's in the skin. It's next to it. It's not it's not a picture right there. Yeah.
I think that's the TFL. That's your tensor fascia lata coming in.
I thought it was more to the front.
Well, that's getting pretty front there. It just has to get in front of the hip. And remember, your IT band runs down the side of your leg, not down the front.
Yeah, I see it.
Okay. So, for example, Ms. Torres, what's this muscle?
The TFL.
Yeah. And I think that's this muscle. If you look at it, I know it's not the leg's not in the same position, but that muscle's where that bulge is.
Okay.
Oh. Okay.
TFL. Good job. Good. Thank you both. Oh boy, these are tricky. Mr. Kandaris, sir. Oh, Miss Moore, you're back?
Yeah, I'm back.
Yeah, no worries, Miss Moore. I'll get you in just a second, okay? Or did you have a question, ma'am? No? Okay. Mr. Kandaris, do you know what muscle group this muscle is in?
The adductor group.
Good. That's kind of where I'm at. Do you have any idea which adductor it could be?
Is that Magnus?
Well, okay. So what does the word Magnus mean?
Big.
So does it look really big compared to the rest of the thigh, or is there some reason that, you know what I mean, you're going with Magnus?
I guess proportionally it seemed kind of big in the second, but yeah, no, it's not that big.
So, and also, by the way, to let everybody know, Magnus is found in the middle thigh, right? But it's very posterior. This muscle is very anterior, right? So, is it the gracilis, sir?
No.
No, because the gracilis runs all the way across the knee. Is it the longus?
No.
No, probably not. Just not long enough. Okay. So that leaves us with, what does that leave us with? What two muscles could it be?
Brevis.
Brevis and Bactenius. And that's what I would be guessing between. Do you want to take a guess?
Yeah, brevis.
Bam. Adductor brevis. Good job, sir. Good. What action does the adductor brevis perform?
Adduction of the hip.
Yes, thank you. Good. I was like, please. Okay, good. Thank you, sir. All right, Miss Moore.
That's me. That's me.
That is you. I'm so glad you're the first person who's excited to talk to me. Miss Moore, thank you. Hey, Miss Moore, what? Now, there's kind of two muscles here, but we're talking about the bright red one that his fingers touching. What muscle group do you think that's part of?
Adductor longus.
Adductor.
Oh,
somebody's talking.
Yeah, Miss Petrie didn't know her. She was off mute and she's mouthing, so I just put her on mute. She didn't know.
Okay. Thank you, Peachy.
What do you think this muscle is?
Adductor.
Adductor, yes. And this last one, if we look at it, that was adductor brevis. What do you suppose this is?
Adductor. Wait. Adductor longus. Adductor brevis. No. Longest. That's not long enough.
Well, remember, the longest is not the longest one. It's just the longest of the abductors.
Oh, okay, so it might be longest. It's kind of long.
It is longest.
Okay.
This is important for everybody. Guys, I know that the word is longest, and it means it's longer than the brevis, but it's just not that long. It doesn't even come close to comparing to the magnus, let alone the gracilis. So, adductor brevis right here. Longest right there. Good job, ma'am. Really good job. Thank you.
Thank you.
Thank you. Miss Hunter.
Yes.
Miss Hunter, what is this red muscle on the inside in back, essentially, still medial, but posterior medial, part of this person's leg? What is that muscle?
Is that the semi?
No, not the back side of the leg. I apologize. I might have thrown you off. It's still the medial compartment of the leg.
It has to be vastus.
Medial compartment of the leg, like where all your... What muscle?
Oh, it's still an adductor.
Thank you. It's still an adductor. But your adductors are so many and so big that some are stacked up a little bit further back and some are more in front and all that kind of stuff. This guy's in back of your middle thigh.
Well, it looks big, so I'm going to go with Magnus.
Yeah, I would go with Magnus too. You're right. And adductor Magnus, by the way, this came up in your test and everything, everybody. It's big and it's so far back that it acts a little bit like a hamstring. So it does some of the actions that a hamstring does, even though its main job is to adduct you. But that's how you can tell that it's the adductor Magnus. It's big and it's further back. It's further posterior in your medial thigh. They're still all between your legs, but it's further back. You'd have to reach further between your legs to get to it. Good job. What is the action of this muscle, ma'am?
It's the adduct. Oh yes, the adduct.
Adduct the what?
Oh, adduct the what? Oh, adduct the leg.
Let's say the hip.
Oh, and extend the hip. Okay.
No, just adduct the hip.
Oh,
it does extend the hip a little bit, but don't worry about that.
Adduct the hip. Okay.
Adduct the hip. Cool. Thank you, ma'am. Miss Harper.
Yes, sir.
What is this muscle?
It's still in adductor, right? Adductor group.
Well, it's in the medial leg, so that's a good guess.
It's the last one, the gracilis.
And why do you say gracilis and not adductor longus? It's really long.
Because it's in the long that's in the middle, the really middle side.
Yeah, and the longest isn't the longest, really. What else do we know about the gracilis? How many joints does the gracilis pass over?
It's also cross over 2 joints, the knee and the hip.
Yes, and it goes down the dead center of your medial leg. The gracilis does, by the way, everybody. And she is 100% correct. Thank you so much. What's the action of the gracilis?
The gracilis, it's adduct the hip, and
yeah.
then it's flex the knee.
She's right, by the way, everybody, because it inserts in the pes answeritis, it can help flex the knee as well. Good. Awesome. Awesome, awesome, awesome. Really well done. I love it. Love it all. Okay. And Miss Hanson.
Is that the Bactenius?
Yeah, that's the Bactenius, just because it's...
So can you go back and show us the brevis and Bactenius?
Yeah.
Just the difference.
So let's make sure. That's Bactenius. Way up high there. Also very anterior. There's the longus. And there's the brevis.
Okay,
Now,
so
I wish
it
I could
does
show
look
all.
different.
But I think the Bactenius is right here.
Yeah, it looks like it's right next to it.
Yeah. And by the way, I personally don't think... We're not showing you these pictures because you should know like every last little thing, and like normally we're working all the adductors together, but we want you to be able to tell the gracilis apart from the magnus apart, like the big stuff. I don't think we would put a Bactenius and a brevis right next to each other and make you figure that out. But it's good for you to ask. You're absolutely right. And we will do these again, and we are filming this presentation right now. So Bactenius, you are right. Thank you, ma'am. Miss Felix Osuna.
Yes.
What is this muscle here?
Is that the TFL?
It is the TFL because this is the IT band, which by the way might be what they're really asking us, but that doesn't matter. This is the IT band. What does TFL stand for?
Tensor fascial lateral.
Yeah. By the way, you're right. They just want us apparently to name this as the IT band, which it is. But that muscle there is the TFL, the tensor fascial lateral. You're 100% correct. And if this was an actual test, it would say, tell me the red thing, tell me the whatever. Don't worry. This just gives you an idea. Good job. By the way, can you tell me an action of the TFL, of the tensor fascial lateral?
Can I abduct the hip?
It might be able to a little bit, but it also is in front, so it's another hip flexor.
So it'll flex the hip.
Hip. Or anteriorly tilt the hip. No. So it's another hip flexor that can be a culprit of anterior tilt. Good work. Okay. Miss Cooper.
Hello?
Hello, ma'am. Hi. You look dignified and elegant. A little back leg.
It's the hoops.
I love it. What is this muscle right here? Is that the top of your IT band?
Did somebody say it?
Yes, they did. Just before you. They were answering this question here, but which this is a good picture of the IT band running all the way down the leg. But what is the muscle that attaches into the IT band?
The IT band muscle.
Yeah. Well, we need a muscle. The IT band is a lot of fascia. So we need a muscle that would tense up a lot of fascia.
Tensor fascial lateral.
Thank you, ma'am. Tensor fascial lateral. What is the action of this muscle since it is in front?
Extension.
What happens in front of your body? What happens in front of your body? Flexion's in front.
Then flexion.
Cool. Thank you, ma'am. Flexion. Tensor fascia lata. Boom, boom, boom. Okay, this should be interesting. Miss Bilotic, what muscle? It's not interesting because I'm calling on you, Miss Bilotic. It's interesting because of the muscle. What muscle is this? We might have already covered it. This is a new picture, but a muscle we already covered. Yes, go ahead.
The sartorius.
Yes, ma'am. I think it's the sartorius. It goes diagonal across the leg. That's the big thing. It's a long strap muscle that goes diagonal across the leg, not straight down. It's the sartorius. The sartorius creates.
Is like straighter, right?
What?
The gracilis is like straight.
Yeah, the gracilis is straight and goes to the same place because they go into the pes anserinus, but it goes straight down the middle of your leg. You're absolutely right. It doesn't cross from one side to the other. This crossing of one side to the other makes the sartorius have 3 actions. It can cause me to lift my leg up at the hip. What do we call that? Yes, flexion of the hip. It can cause me to bend my knee and back. What do we call that?
Extension of the knee. Flexion of the knee.
Yes, because it's the one that does it back. So flexion of the hip, flexion of the knee, and it causes my thigh to rotate out. Rotate out. What kind of rotation is that?
Medial? Lateral?
Yes, rotating out, lateral. Good. Okay. That's how you sit cross-legged. Thank you, ma'am. Another little sartorius picture here. Boom. Okay, Miss Giannis, what is this muscle?
The gluteus maximus.
You're wrong. No, I'm kidding. Of course it's gluteus maximus. What are the 2 actions of the gluteus maximus?
It extends the hip.
Powerful hip extender. Yes. And because it's diagonal, can you see how it might do something else?
Is it a lateral rotation?
Yeah, laterally rotate the hips too. You use that a lot when you walk, believe it or not. Very well done. Thank you, ma'am. Miss Torres. Miss Torres! Oh, I've got a wingdinger for you, Miss Torres. What is this?
That's the piriformis.
Yeah, she's right. How do you know it's the piriformis?
Because the T?
Yeah. Everybody, it's hard to see here, but this is the edge of the sacrum. This makes the top of the T. This is the base of the letter T. That's how you tell it's the piriformis. The sacrum makes the top of the T, the edge. I know you can't see it from here. You'd actually have to. And this, it lines up perfectly and it hooks to the top of your greater trochanter. This is the piriformis. What is the action of your piriformis?
It's the hip rotator?
Lateral hip rotator.
Lateral rotator?
Yeah, it's in that group. It can do some other stuff, but that's really what's important. Lateral hip rotator. Cool. There's your T, everybody. They're trying to explain to you how you find it. You can really use this on people. It works. You can find their piriformis right away. Very cool. All right. Very, very cool. Okay. Miss Stanley. Miss Stanley, what is this?
I'm just staring at it. I'm not ignoring you.
I believe you. Take your time. Gives me a chance to catch my breath.
Still a hip rotator.
Okay, so you think it's still a lateral hip rotator. I would agree with you.
Yeah.
So which of the 6 lateral hip rotators is it?
I feel like you're about to draw a bunch of stuff, and I don't know what you're doing.
I'm not going to draw anything. I was just erasing the board.
Can you like just list them? Like just list the rotators. I gotta think about it.
I don't know my rotators very much. Can you list the 6 for me?
Can you not be like that?
I'm old. Like it happens when you get to my age. I just forget stuff. What are the 6 lateral hip rotators?
It's got the obturator ones.
It's what now? I don't know what the 6 are even, so I don't even know where to start.
Okay, well, okay, obturator internus.
Yep.
Obturator externus, so that means there's gemellus superior, gemellus inferior.
Yep. And what's the final 2?
Oh. Piriformis.
Mm-hmm. And then there's one more.
Quadratus?
Quadratus lumborum?
No.
Oh, that's right. It's not in the lumbar region. Quadratus
femoris.
Quadratus femoris. Okay, yeah, that sounds like all 6. Okay, so you got the piriformis, quadratus femoris, gemellus superior and inferior.
Quadratus femoris. I'm so freaking okay. I'm slow.
So why is it? What do you think it is?
The quadratus femoris,
And why
because
do you
it's
think
connected to the femoral bone and it has 4 friggin' sides.
Let's see if you're friggin' right. You are. Thanks for using your friggin' mind.
Jeez, I'm slow.
It's not a speed test. This is exactly what we want. We want to. You want to graduate thinking students. You guys are thinking. I love it. Quadratus femoris. Now remember, everybody, which is the most superior rotator cuff? God. Which is the most superior lateral hip rotator? Yes, Ms. Yanas. It is the piriformis. Look at this picture. Which is the most inferior lateral hip rotator? Somebody mouth it.
Is it the greatest?
Yes, yes, yes. So look, it's not much difference. You've got, this is the quadratus femoris, and believe it or not, the piriformis would be right through here, and the other ones are going to live right in this tiny little area. We won't even try to identify all the other ones. I don't think. They're too hard to identify. All right. Thank you, thank you, thank you, by the way. Miss Petrie, this is not a muscle. What is it? It's not a muscle.
Is that the sciatic nerve that the piriformis is pinching?
Yes. And everybody, can we see? Here's the piriformis. Here's the quadratus femoris. Here's the obturator externus. Internus is back in there. Gemellus superior and gemellus inferior. They're all down in here. But that's why we care about this area. And you can see how tiny it really is when you get everything together. Cool. Good job. Thank you. Aha. Miss Nguyen, this one's tricky because we normally talk about it as 2 muscles, but this is just one of them. Miss Nguyen, what is this muscle that's inside the hip of this person going to their lesser trochanter?
I think I don't know how to talk that. Cock.
Just say it with me.
Iliacus.
Iliacus. She's 100% right, by the way. We talk about the iliopsoas. The iliacus is the ilio part of the iliopsoas. And the iliacus actually goes from inside your hip down into your femur. And so what action can it create, Miss Nguyen?
Action, I think, action extension. Extension on the, I don't know how to do.
It's in front. It's still in front. It's still a front muscle in a way.
Flexor?
Flexion of the hip. Flexion of the hip. Good job. Thank you, ma'am. Miss Moore.
Yes.
Miss Moore, what is this muscle? It's part of 2 muscles too. We often talk about it with the iliacus. And it's I can give you the first letter it starts with, but it's going to throw you off.
Okay, where start with?
Starts with a P. but that's not very helpful.
It starts with a P.
It does start with a P, but it doesn't sound like it starts with a P.
Psoas.
Yes! This is psoas major.
Yeah, you just took the words out of my mouth.
You just said psoas. That's great. So, when we talk about your iliopsoas, everybody, we're talking about this and this together because they both insert into the lesser trochanter of your thigh, and they both create what action, Miss Moore? What action do both these muscles create?
Flexion.
Flexion of the hip. You're exactly right. You're nailing it, Miss Moore. Which means they can also create an anterior tilt of the hip, which is why we care about these muscles, right? Right. Love it. Thank you, ma'am. Psoas line there. Good. I just showed you a picture of the abdominal aorta here because sometimes when you're going after the psoas major, you get a pulse, and that's because your hand is on the abdominal aorta and you need to back away. You've gone too far medial in on the client. Okay. Wow. Ooh, this one should be interesting. Miss Stanley, you got excited. You actually did this and you smiled. I know. So, Miss Stanley, let's go out of order here for a second. What do you think this is? You seem so excited about it. I love your enthusiasm.
And I feel like I'm going to get it wrong.
That's okay. I just like that you're excited.
I thought it was I always say it kind of wrong, but it's the one that is part of the rectus spinae group.
Good. I would agree with that.
It's the iliocostalis.
Well, does it grab? It looks like it's grabbing onto all the ribs. That would be iliocostalis. Is it grabbing on the crest of the ilium?
Yes.
Does it swing kind of wide and come back in at the neck? That's very iliocostalis. Yes. So I think you've got a very good guess here, ma'am. Let's see. Okay, ma'am. So you are right. So let me ask you this. Bilaterally, both sides working bilaterally, what action does this muscle create?
Wouldn't it be extension of this? I was going to say cervical vertebrae, but it's all of them.
So yeah, extension of the vertebrae, extension of the spine, extension, yes, exactly. If it's working unilaterally, what might it do?
Well,
yes.
So it would...
What do we call that? I see people doing it. So what do we call it? What do we call what Miss Petrie is doing over there?
Why am I trying to say laterally flex?
Because if you're talking about the spine and not the knee, that is a very appropriate thing to say.
Oh, okay.
A little joke there, too.
Yeah, laterally flex the vertebral column.
Thank you, ma'am. That's exactly what it does. Good job. Okay. Oh, that's kind of tricky what they did there. But anyway, we'll figure this out together. Let's see, where was I? Miss Monreal. Miss Monreal? Did I lose you? All right. Miss Monreal, can you hear me?
Okay. I was on the phone, but I don't know how to unmute that, so I had to get back on the video.
Sorry. What's this?
Okay.
What's this muscle? Or what muscle group is it part of first?
Okay, hang on, because I'm trying to drive. So it is the erector spinae group.
It is. So it's erector spinae muscle.
And
that's
I
for
just
sure.
Want to
Go ahead.
Okay, I just want to clarify that I wasn't on the phone with someone else. I was on the class call.
Oh, I know.
Does
Thank
that
you,
make
ma'am.
sense?
Thank you for clarifying.
Okay.
But yeah, we're golden. I saw that.
Okay.
Plus, I trust you.
Okay, so it's the erector spinae group.
Yeah.
Do you want me to answer something else?
Yeah. So can you guess which of the three it is?
Okay, hang on, because I have to enlarge the picture a little bit.
Yeah. It's not obvious, by the way. It's a little tricky.
Longissimus.
Why do you say longissimus?
Well, because iliocostalis is going to be out a little bit further, and that connects all the way, the longissimus connects all the way to the top.
Yeah, do you guys see her logic? She's saying it's all, I would have almost gone spinalis, but the fact is it goes all the way to the top, which is what we know the longissimus for. So I would guess she's right, and she is right. Good job, ma'am. Hey, Miss Monreal, since I have you, what actions does the longissimus create bilaterally?
Bilaterally. Okay, I always get mixed up with what.
Both sides working together, bilateral.
Okay, bilateral. So.
Pull on both ponytails.
Okay, so is that called an extension of the back?
Yeah, extension of the vertebral column, extension of the vertebrae, extension of the back. We'll take it.
Okay, so flexion would be to go forward, correct?
Yes, definitely not flexion. It's extension of the back. Okay. And what about if it works unilaterally?
So, I mean, I know he's going to bend, but I'm trying to think of what the term. Is that lateral flexion?
It is! Good job. All right, thank you, ma'am. Mr. Kandaris, sir.
Yeah.
It's an unusual picture because they're kind of showing you like half the cervical region of the same muscle and half the thoracic region on the other side of the same muscle. But what is this muscle, sir?
The one like by his neck, like we were saying? Or
the whole thing, believe it or not, is the same muscle, but they're only showing you half the neck part, and then they're showing you the other half of the thoracic part. So to make it a full muscle, you'd have to add the other half of this side of the neck and the other half this side of the thoracic region, but it's the same muscle. What is that muscle?
Is it spinalis?
And why do you think it's spinalis?
Because it's very close to those processes.
Yeah, it actually attaches to the spinous processes. You can see it in the picture. Should be the spinalis. Excellent job, sir. Sir, if this muscle works bilaterally, what action does it create?
Rotation.
If both sides of this muscle pull bilaterally, just like all the other spinal erectors, what action does it create?
I'm doing it right now, but I'm forgetting the term.
It's what the last two people said.
I was brushing my teeth.
So what happens if both sides of those back muscles tighten? What do you call this?
I guess flexion of the vertebrae.
So do flexions happen in front or behind you?
Well, in this case, it's behind.
Okay. And so what happens when I go back? What actions happen behind me most of the time? Flexions almost always happen in front of your body except with one exception, which is your knee. Extensions happen behind you. So it'd be bilaterally, so it'd be an extension of the vertebral column.
I just feel like that action, it looks like when you're going back like that, it seems like you're extending your abdomen.
Sure, but it's still an extension.
Okay.
Yeah. The fact is I'm moving back, and that's an extension. If it worked unilaterally, sir, what would it do?
It would be flexion of your side.
Yeah, so what do you call flexion to your side? You're very close, sir.
Is it an abduction?
It's called a lateral flexion of the spine.
Okay.
Because because you can't really take away from your spine, so it just bends laterally. Yes, Ms. Petrie, do you have a question, ma'am?
Would it be lateral flexion of the spine and neck?
Oh yeah, sorry. But the neck, if you think about it, your neck is your spine.
Because I wasn't sure if it was because of how the spinalis curves.
I know. Yes, yes, different sections can work differently. And so you're right. You could say lateral flexion of the neck, lateral flexion of the spine. I just want to point out, though, your cervical vertebrae are part of your spine, just like your thoracic and lumbar. So lateral flexion. But you're right. Yes. Could it help laterally flex your neck? Yes. Yes, absolutely.
Okay. I just wasn't sure if it did something else because of how it curved to the neck, if it was missing an action.
No, probably not. Yeah.
Okay.
Yeah. That was good. Really. Okay. Hold on, I'm just checking how much time we've got left here. Oh, this is a fun one. Okay. Miss Hunter. Miss Hunter? Miss Hunter, what's the most fun muscle in the whole group? I saved it just for you. Not going to let any of the other students answer this question. Miss Hunter, where are you? Yeah, that's right, Miss Stanley. That's your favorite. Yeah, I know. And Miss Hunter doesn't even care. She's not even going to answer. Yeah. It's kind of like she's kind of spitting in your face right now. Yeah. Okay. Miss Harper.
Oh, yes, sir.
Miss Harper. Miss Harper, what are these two muscles?
That's the long one that goes to the sacrum is the multifidi, and the shorter one is the rotators.
Yeah, I love what she did, everybody. So she told us the difference between the rotatories and the multifidi, right? We know they look like shoelaces. We expect this look. But she said the longer ones that go on the sacrum are the multifidi. And the shorter ones are the rotatories. And she's 100% right. Yes. Good. All right.